to make sure that they are taken care of. When they talk about their stories during the trauma, we get to know where the specific needs of each family could be reached to the communities and to help them in seeking help. And then let's talk about the workforce gaps. Shortage of culturally trained mental health professionals who understand refugee and newcomer experiences. Yeah, regarding the workforce gaps, there is not a lot of volunteers. So we talk about the shortage of culturally trained mental health professionals, which is what we need. Talking about the culture of each family, of each refugee, newcomer coming from different countries all over the world. So we do need culturally trained mental health professionals that will actually talk about each culture, specific needs to each family or to each language barriers that could answer them and help them. So we do talk about workforce gaps, and in this area, this is something that is really needed. There is a lack of culturally trained professionals, mental health professionals out there. So yeah, this is one barrier that we are lacking, but we want to keep talking about it. This is not something that we want to just push to the side, because it's something that we really want to focus on, so everyone is aware that culturally trained mental health professionals are lacking in the workforce. Let's talk about the geographic isolation. So rural settlement locations and lack of transportation further reduce access to available services. Yeah, this is one thing that we need to work on as an organization. We need help in this area because we do not have enough transportation power or logistics that will actually help us to reduce access to available services. So we're asking you, our audience, this is something in an area that we would really like you to partner with us in terms of helping us to further reduce access to available services. Transportation is something that is very crucial to the survival of refugees and newcomers. Now, I would like to give you recommendations and call to action. Investing in community-led models. Fund refugee-led and community-based mental health initiatives that leverage cultural knowledge and lived experiences. Train culturally competent staff. Mandate cultural humility and trauma-informed training for all frontline workers in newcomer services. Reduce stigma through storytelling, using media, documentary, and community campaigns to normalize help seeking and celebrate resilience. Yeah, we need to celebrate resilience. Integrate MHPSS into all services, embed mental health screening and support into housing, employment, education, and legal aid services. Yeah, if we have legal aid services in place, this is very crucial as well, because this could help them. For most refugees and newcomers, they don't have the money to pay. And yeah, legal aid services could be in place and could help them. Push for mental health funding allocations specific to refugee populations and newcomer support programs. So advocating for policy changes that will improve the lives of refugees and newcomers. Building long-term support systems, move beyond crisis response towards sustained community-integrated psychosocial well-being programs. So those are our recommendations. The power of communications and advocacy in mental health. Now, stories are data with the soul. Every refugee narrative carries the power to transform policies, build empathy, and mobilize communities to act. Are we going to shift the narratives, mobilizing resources, building accountability? Join us in shifting the narrative, replacing deficit-focused portrayals with stories of strength, resilience, and contributions from refugee communities. Will you be mobilizing resources with us? Strategic communications campaigns that secure funding, partnership, and political will for mental health programs, and building accountability, amplifying community voices to hold institutions and policymakers accountable for mental health commitments. So we need you. We can't do without you. Together, we can build mentally healthy communities for all. Mental health is well-being. It cannot be separated from integration success. Community-led, culturally responsive approaches are most effective. Every sector has a role: health, housing, education, employment, and faith. Yeah, including the churches. We need everyone. Storytelling and advocacy are essential tools for systemic change. Now, before I go, I would like to conclude. I leave you with this thought. Every refugee and newcomer deserves safety. They deserve more than safety. They deserve belonging, they deserve healing, they deserve hope, and they deserve communities that sees not only their needs, but also their strengths, their talents, and potentials. Today, I challenge you all, each and every one of us, to move beyond awareness and into action. Yeah, into action. Let's all listen deeply. Listen more deeply to their words, to their stories, to their concerns. Advocate more boldly. Reach out to others. Reach out to communities. Reach out to the refugees. Collaborate more intentionally. Ask us questions. Support more compassionately. Because mental health is not just a healthcare issue. It is a human issue. We all feel it. We all know that people are hiding, caving in, and not wanting to talk. And so when we invest in the well-being of refugees, newcomers, and displaced communities, we are not only simply changing individual lives, we are strengthening families, transforming communities, and shaping a more compassionate future for all. So I beg you today, let us be the generation that does not merely welcome people across borders, but walks alongside of them on their journey towards healing, belonging, and hope. I'm praying that this conference we'll discuss today will inspire more action, more partnerships, lasting impact for refugees and newcomers across Canada and beyond. Thank you.
Thank you so much, Sister Dayo. What an amazing presentation. Mental health is a human issue. It's not just a physical, it's not just a health issue, it's a human issue. Thank you. Do we have any questions for her, any contribution? Anybody in the room? Any questions? All right. You have one question, Sister Dayo. Hold on.
Okay.
Okay, thank you very much for that presentation. My question, it will be what you are doing to be able to connect with other organizations that currently have some of the tools that you have. For instance, when we talk about legal aid, there is already legal aid Alberta. So how are you trying to connect, establish some form of relationship? I also know that there are other non-profits that, not-for-profit, that have justice programs for either youths or even seniors. Are you reaching out, because sometimes you don't know what's available until you reach out to other organizations to see how they can, support what you're doing.
Thank you very much for your question. Yeah, first of all, I would like to say that it's not easy to collaborate or to have partnerships with organizations. But we do try our best at LHI to reach out to a lot of organizations, asking to be partnering with them, asking to see if there are ways for us to collaborate with them to help us into securing help regarding refugees and also newcomers. So first of all, what we do, we gather stories of refugees. We listen to them, to their problems. We listen to their pain and what they have been enduring. So these stories that we gather is what we share to communities, to partners, and to those that are going to help, like government organizations. Right now, we are at the stage of trying to secure help in that area, trying to secure help in having partnership with organizations. So if you're in an organization right now, we would love to partner with you. We don't have a lot of funding to be able to help at LHI, so we are looking for partners that will be able to help us to fund some of these programs to help refugees grow. The legal aid is already in place, but we need to make sure that these refugees can have access to legal aid as well. So when they come, we again gather their stories. We share stories online, on YouTube. We share their stories on social media, on LinkedIn, on WhatsApp, and also on Instagram. So sharing stories is part of LHI's model, storytelling, and that helps us to try to secure help in terms of getting all the resources that we need. So remember, LHI in Canada is new. And so we're still at the beginning stage, and we need your help. We need your help to partner with us, to help us, to carry these stories along with us, to help us to secure the funding that will help these refugees and newcomers to reach their full potential.
Thank you so much. Any other question? All right. Sister Dayo, thank you so much for your presentation. Thank you for joining us today.
I have a question for the audience, though.
Okay, everybody bring your pen and paper. You are facing exam. Okay, go ahead.
So remember, at the beginning when I started, I asked you a question. I don't know who can remember that question.
Who can remember the question Sister Dayo asked at the beginning of her presentation? I wasn't here, I went out that time.
Yeah, because I want to make sure that people were listening, and it's a very, very good question.
Okay, Sister
Dayo,
Sister Dayo, remind us again, what's the question? I will answer it.
Okay, my question was, when a refugee crosses a border, what do they carry with them?